am on my period is not something that girls say to get attention or to get out of arguments. In fact, I think making fun of it is dangerous by itself, because when you make jokes about it, people actually somewhere start to believe that that's the reality, and it's not. It's an awful, awful thing where you wake up one day and the world is saying, be like this, but you just want to be like this, but you can't be like this. You have to be like this. And it is a hell of a lot of stress to be like this. And I can say this because I've been through it all. And to explain a little bit about why I no longer tolerate this shit, I have to take you back to my past. So we're going to start with my facial hair shaving gel. I love it because prior to this, I didn't know how to shave. And there was no internet, and I was very, very scared to ask someone for advice, because then they would want to know what I'm shaving, and I couldn't say that I'm shaving my beard and mustache because I'm a girl and I'm supposed to magically be free of all hair. These are my collection of acne creams, including a very, very expensive imported snail mucus cream that is meant to clean up my acne scars from the past. Yes, I rub snail snot on my face to have smooth skin. This is a tube which contains fat burner tablets because I want a flat belly, and somehow my belly doesn't care about my wants and not wants. So this little pellet mixed with water helps me burn fat. And this here is my kadha, which somebody told me if I have it, it'll induce my period. And it's essentially cinnamon, ginger, cloves, and shatavari. It doesn't always work, but it did help me feel a little less helpless, that something was within my control about my own body. And so I still have it sometimes when I feel like I want to be in control of myself. This is the world of someone who has struggled with excessive hair growth, acne, a menstrual cycle that was more unpredictable than what politicians are promising, and weight gain. And the sad bit of all of this is that with each and every one of these symptoms, I was trying to treat them and manage them independently when they all actually fell under one parent health disorder, which is called the Polycystic Ovary Syndrome, or PCOS. Here is something I really didn't know before I started research on this episode, even though I have been diagnosed with PCOS. But PCOD, polycystic ovarian disease, and PCOS, polycystic ovary syndrome, are not the same. PCOD is a condition where the ovaries in women produce immature or partially mature eggs, which can form cysts leading to hormonal issues. PCOS is a much, much more complex disease where you have more hormonal issues, more issues with your periods, and you can even have a lot of metabolic disorders. Do I wish that I knew all my health issues were caused by the same disorder? No, because I don't want to wish for the impossible, and when these issues began, there was no knowledge about PCOS or PCOD. In fact, I remember elder women at that time in my family discussing about ovarian cysts, and they would just say, oh, your ultrasound report says cysts, don't worry, ours also said them, but it's nothing serious. And they were actually confusing follicles with cysts. And follicles are actually very normal. They are fluid-filled sacs in the ovary, and they contain immature eggs. And there are thousands of them. And as they grow, they release an egg which goes through your fallopian tube and then hopes to meet a male egg or sperm along the way. But if you have hormonal imbalances or issues with fertility or weight issues, diet issues, stress issues, sleep issues, the whole Googleable gambit of issues, then the follicle doesn't rupture and release its egg. It grows and it becomes a cyst. And these cysts can be seen on an ultrasound, and they're a sign that you have issues with your entire reproductive cycle, or PCOS. And what these issues are and how to manage these issues, and if these issues are even real, it's really not something that I feel I or Google are authorized to say. But I have someone joining me in the next segment. Her name is Dr. Anuradha Kapoor, and she is very qualified to talk about this because she is the Principal Director of Gynecology at Max Smart Super Speciality Hospital in Saket, Delhi. And she's also run their PCOS clinic for a very long time. And she's here to tell us what it's all about. I'm just going to start with something that every 30-year-old I know has had to undergo at some point from their parents. And that is a question which goes like this. If you have PCOS, then how come I never heard about it when I was growing up?
Yeah, that's a very interesting question. And the answer to that is that obviously we have better diagnostic tools. Ultrasound has been there for the last 50 years only. And obviously the urbanization, the lifestyle change, the kind of diet that we are having also contributes to PCOS. PCOS is a multifactorial disease. And obviously the physicians are also much more aware of it. So we look out for it now because it has a lot of consequences, which I'm sure we're going to talk about later. So because of all these reasons and because of a lot of environmental toxins also, they say these are endocrine disruptors in the environment. So all these things together contribute to the increasing incidence of PCOS.
I asked you why wasn't PCOS there before? Because there are people who are very skeptic and they do think that, this is just a modern medical thing, one more thing to, go and get billed for. But I think you have something that can prove everyone wrong, and that's your 20 plus years of experience where you would have clinically seen the consequences of this disease. Can you tell me what you've observed?
Yeah, there are multiple consequences and very long-term consequences. And every fifth patient who comes to us in the OPD is nearly a PCOS. Either she's a teenager. See, it's a benign disease, but it stays with you lifelong. It doesn't go away. So you can't treat it, but you can control the symptoms. And you can, supposing it's a 16-year-old and she's obese and she has a lot of acne and increased facial hair and she's obese. So she has a lot of low self-esteem, right? She can go into depression and she'll be very isolated from her peers and all. So at that time, you can help her by treating her acne, her increased facial hair, making her lose her weight and regulating her cycles. In the 20s and 30s, then she will have infertility. So very common infertility, if you see the causes, the commonest cause is ovulatory disorder. So that means 25% is ovulatory disorder, then about 15% is endometriosis, then 11% is a tubal factor. And out of the ovulatory disorders, PCOS is the commonest cause. That means in PCOS, what happens is that you don't ovulate every month. Like every woman ovulates every month, and then if that egg gets fertilized, she gets pregnant. So these are anovulatory disorders. PCOS is an anovulatory disorder. That means she's ovulating every 3 to 4 months. So this is the commonest cause of infertility. So this will be something which will have to be treated. Then supposing we head towards 40s, supposing she's, for whatever reason, she was not in that 70 to 80% who were infertile, she was in the 20% who conceived with having PCOS also, then she has a lot of chance of having gestational diabetes when she gets pregnant. That means she's very inclined to have her blood sugars which are impaired, which can affect, first of all, it can cause a miscarriage. Besides infertility, it can cause a miscarriage. Then it can cause preterm labor. There can be high chances of having a preeclampsia. That means she can have very high BP. She can have a very big baby, which can have a shoulder dystocia. So more chances of having cesareans. So PCOS plays havoc with your life throughout. So it has to be controlled. It has to be looked out for and it has to be controlled.
When I had PCOS and I went to my gynecologist, and this was a while ago, she gave me a certain hormone improving medication diet, So I would take, say, estrogen for 10 days and then I would take progesterone for 10 days because it got so bad for me that I wasn't bleeding at all. So I would have to be on a sort of lab-made chemical diet to make myself bleed. And today, my friend who's in her mid-20s, she's doing the same thing, except she is doing it with what I've got to show you, seeds. And this is called seed cycling for fertility. So she takes sunflower, pumpkin, melon, and flax seeds based on the time of the cycle to induce certain hormones in her body. Aside from seed cycling for fertility, we have tofu diets for fertility. We have water diets for fertility. We have, the most overused word ever, antioxidant diets for fertility. We have sleep diets. We have walking diets. We have yoga diets. We have positive mindset diets, which is basically your diagnostician says you have cysts, but think positive, it'll go away on its own. So we have all of this for fixing our hormonal imbalances. So I want you to tell me, why should I then go to a hospital, stand at a billing counter, get a test done, then again go to another billing counter, meet an OPD doctor, then go to another billing counter, get my medicine, then go and get my car where I don't go to a billing counter but I am billed. So that's somewhere where I'm coming to. It's the fact that a lot of people feel that we go to hospitals, waste our time and money to cure a disease that's been created by hospitals to waste our time and money. Would you agree with that?
Absolutely not. First of all, these are all adjuvants. Like, you don't have a PCOS diet. You have a good, healthy diet. That means you have lots of fruits and vegetables, and you have less of carbs and less of fatty food, right? So obviously that is going to decrease your dyslipidemia, your diabetes. So that makes logical sense, right? So you don't have a PCOS diet, but you have a healthy diet. Secondly, all these flax seeds, we also have a PCOS. We also have myoinositol and D-chiroinositol and other nutrients. So these are nutrients which are going to help. But they are not going to treat PCOS, or they are not going to treat infertility. For that, I have to make the patient ovulate. So flax seeds are not going to make her ovulate. So for that, I will have to give her an ovulation induction drug, right? So I don't want to name them, but you have letrozole, or you have gonadotrophins, or you have other medicines. But you have to make her ovulate. Then you have to monitor her cycle, see that she ovulates. And then that is the time that you have to give her a trigger and then tell them to try. So that cannot happen with adjuvants. Right? You have adjuvants for everything, but you have to have a treatment, pharmaceutical treatment.
In terms of treatment, we've already briefly talked a little bit about, the medications available, but can modern medicine make cysts go away completely? Is it curable?
No. So PCOS is not, that's a myth that I want to bust. PCOS is not curable, but it will never go away. But it will stay with you for your life, but you can control it and treat it according to your demands in your life at that stage. Supposing now you're infertility, and so we can give you ovulation induction drugs. Supposing you're in your 40s and you have diabetes, then we can give you, besides the lifestyle change, I want to emphasize that lifestyle change is the first treatment for PCOS. That means we tell all patients to have regular exercise, to have a healthy diet, and not to have any junk food. Only then will the drugs help. So, and then after that, you give them ovulation induction drugs. And it's been seen that if they have even a 10% weight loss, her cycles become regular and she starts ovulating. So that really helps. Otherwise, we give her drugs to make her ovulate, which can be tablets, which can be injections, right? And then we monitor her follicle, and then we see that she's ovulated at this time. We give her trigger, and then we tell them to try. So that is how we treat the infertility of PCOS and all. And sometimes if she's not responding or she's very resistant to these drugs, do we have to do that means we do a drilling. We call it PCOS drilling. But that is our last resort, because that can also increase the adhesions in their ovary. So usually we manage by medications.
Yeah. If you don't mind, and I ask you a personal question to round things up, you mentioned you have 2 daughters. Has your experiences at the PCOS clinic at Max somewhat impacted how you've counseled them about their lifestyle choices?
Absolutely, because my elder one is very thin, but even though you can have thin PCOS also, but she's okay, she has regular cycles. My younger one has PCOS. So I had to tell her, of course, her lifestyle change has to be there, but she's not listening to me because she's in UK, so I don't have much control over her. But obviously, lifestyle change is the first thing, that she has to have regular exercise and her regular routine. She has to cut out the junk food and have a healthy diet, a lot of fruits and vegetables, which is not the case with her just now. Plus, then obviously, I've put her on something to regulate her cycles, because she's not married just now. So infertility is not a concern for me, but it is a concern that she's not having regular cycles. Then the other thing that I wanted to tell you about regular cycles is that one thing is obviously that is bothering me, that I don't have regular cycles. I have cycles every 4 months. The other thing is that if you have cycles every 4 to 5 months, that means there's an unopposed estrogen effect on your uterus. And if you don't give a break with the progesterone withdrawal, then in your 60s, you are more predisposed to developing endometrial cancer. So that is why we always say that you can't have, it's okay to not have periods for 4 to 5 months. You have to have a withdrawal every 6 weeks. So that's what I tell her also, that she has to have a withdrawal every 6 weeks, because that is going to otherwise cause some problems later on in the 60s. It's been seen that somebody who has PCOS has 9 times more prone to develop endometrial cancer than a general population person, who would be about 3 times, right? So that is the thing that I counsel her about her lifestyle, about her diet. Plus, I've put her on oral contraceptive pills to regulate her cycle, because that is one thing that you give estrogen, and then that is a progesterone, so it breaks the cycle. So every month then she gets her periods with that.
Okay. And now I'll just quickly take you to ancient Greece, where the father of medicine, Hippocrates, whose oath doctors famously take even today when they graduate from med school and before they head to the party, he wrote about the diseases of women back in his time, and they are extremely valuable records to prove that hormonal imbalances are not new and they're not anyone's fault. He noted that women had menstruation which was too short or too little of blood. And he noticed that these women also had masculine features. So he wrote that they had thick, oily skin, and the absence of menstruation was happening alongside. And then he noticed that these were also the same women who struggled to bear children. And he felt that the problem was actually a result of too much coldness in the body. He was a big advocate of cold and warmth, and he recommended warming herbs. But we had devil's advocates even back then and naysayers, and people said, oh, why should we take these prescriptions when we can pray to Artemis, the virgin goddess who blesses women with healthy periods? And so women wouldn't go to the doctor. Instead, they would go to make offerings of these cakes called amplifon, which is wheat atta mixed with honey, anar seeds, because anar is a symbol of fertility, 1 dried fig and 3 nuts, which was meant to represent the testicles. I don't know why 3, but there were 3. And they also offered wine, honey, milk, fruit, flowers, and if they were very desperate, even the antlers of deer, because she was also the goddess of hunting. And somehow then women started realizing that infertility was an issue, so they also began dressing up girls before they hit puberty as bears and then making them dance in front of the goddess. So why would you go to a doctor for help when you can hunt deer and dance as a bear? But my doctors have cured me of hormonal issues, of depression, of attention issues, even of nightmares. And it didn't happen overnight because the body is complex and healing it is a very complex science. But I would rather trust someone who has actually spent decades learning that science than, somebody from the past who says that, having warm herbs will make everything okay, or that round objects as offerings will appease the gods because our belly is round, so the uterus must be round only. But no, thank you. I'll take my chances at the hospital billing counter. What about you? What are your thoughts and experiences with PCOS doctors and billing counters? You can share them with me at pods@indiatoday.com or on 8588966996. And if you've enjoyed this episode, please do leave a rating or share feedback through a comment. We are there on many platforms. We are there on YouTube, Spotify, Apple, and the India Today website.